How will access to your health data change after the pandemic? In times like these, we have the space to step back and think about how key parts of our society, like healthcare, work. For a while, we've been talking about how health information should be connected so we can all get the best care. This is the concept of interoperability. In March, just as the quarantine was beginning for millions of Americans, 2 federal healthcare offices released a major rule on interoperability. The overall goal for this rule is to empower patients with easy, free, and secure access to their health information. It requires clinical and claims data to be made available in the electronic form to patients at no cost. As you might have guessed, this was a bit lost in the shuffle. But even as we are focused on fighting back against COVID-19, it's important that we don't lose sight of the vision of how healthcare should work. In fact, with free patient access to their own health data and the ability to share it with any platforms they choose, the COVID-19 response itself could be streamlined. Here's how. What if you need to seek care at the emergency room? When the interoperability rules against information blocking are implemented by 2021, your primary care physician will get notified so they can adequately follow up with you. Coordinating care between PCP, ER, and telehealth providers will become so much easier. That paperwork you needed to pick up from the doctor's office in person? Through interoperability, you can securely access your own information without those unnecessary hurdles. Especially during physical distancing, interoperability will become your second set of arms and legs that will travel for you. Right now, the rules are set to require healthcare companies to open up new avenues for information sharing within 2 years. But what will your care look like in a more distant future? How would interoperability impact how you experience care in this decade? With the ability to control your own health data, patients will be in the driver's seat. ONC's proposed rule calls on the healthcare industry to adopt standardized APIs, which will allow for much greater innovation in how we use our health data to create better care. Imagine a future when your own health information is not scattered all over the place, when you have full control over a single source of truth that pulls together all of your records and enables data-driven care. Interoperability is a step towards such a centralized healthcare hub where you can track your treatments and symptoms, manage hospital records and prescriptions, tap into insights from devices, coordinate care between multiple family members, contribute to research, and connect with people in your chronic condition community. If you take a step back, it isn't a wild idea at all. Rather, it's wild that hubs for your photos, emails, and finances exist, but not for your own health. As patients and caregivers, you deserve better. We'll need new and improved standards for health data privacy too, to make sure that the free flow of information is still secure. Check out our recent blog post on how we can safeguard health data in an interoperable world. If you're a Folia user, we look forward to being your healthcare hub. Tell us what you'd like to see integrated first. EHR records, prescriptions, insurance claims? As always, we're all ears for your ideas.